An overview of pulmonary tuberculosis. By the end of this topic, you should be able to understand the anatomy of the normal lung, understand the global burden and epidemiology of tuberculosis, describe the pathogenesis and clinical features of pulmonary tuberculosis. The lungs are the vital organs of respiration. Their main function is to oxygenate the blood by bringing inspired air into close relation with venous blood in the pulmonary capillaries. Healthy lungs are usually light, soft and spongy, and fully occupy the pulmonary cavities. The lungs are separated from each other by the mediastinum. Each lung has an apex, base, 2 or 3 lobes created by 1 or 2 fissures, 3 surfaces, costal, mediastinal and diaphragmatic, and 3 borders, anterior, inferior and posterior. The hilum of the lung is a wedge-shaped area on the mediastinal surface of each lung, through which the structures forming the root of the lung pass to enter or exit the lung.
Let's test your understanding of the topic. The oblique fissure of the right lung separates which of the 2 lobes? Inferior lobe to superior. Inferior lobe to the part of the superior lobe. Middle lobe from the inferior lobe. Superior to inferior.
What is tuberculosis?
Tuberculosis is a serious chronic pulmonary and systemic disease caused most often by tuberculosis. The source of transmission is humans with active tuberculosis who release mycobacteria present in the sputum. Oropharyngeal and intestinal tuberculosis contracted by drinking milk contaminated with M. bovis is rare in countries where milk is routinely pasteurized, but it is still seen in countries that have tuberculous dairy cows and unpasteurized milk. Tuberculosis flourishes wherever there is poverty, crowding, and chronic debilitating illness. In the United States, tuberculosis is mainly a disease of older adults, immigrants from high-burden countries, racial and ethnic minorities, and people with AIDS. Certain disease states also increase the risk: diabetes mellitus, Hodgkin lymphoma, chronic lung disease, particularly silicosis, chronic renal failure, malnutrition, alcoholism, and immunosuppression.
Let's test your understanding of the topic. What is the incubation period of tuberculosis? 1 to 3 days. 3 to 5 days. 2 to 12 weeks. Or 12 to 15 weeks.
Clinical features of progressive pulmonary tuberculosis. In contrast to secondary tuberculosis, which is an apical disease with cavitation, progressive primary tuberculosis more often resembles acute bacterial pneumonia with a consolidation of the lobe, pyeloradenopathy, and pleural effusion. Lymphohematogenous dissemination following primary infection may result in the development of tuberculous meningitis and miliary tuberculosis. Clinical features of secondary tuberculosis. Localized secondary tuberculosis may be asymptomatic. Systemic symptoms often appear early in the course and include malaise, anorexia, weight loss, and fever, which is low-grade and remittent, and night sweats occur. With progressive pulmonary involvement, increasing amounts of sputum, at first mucoid, and later purulent, appear. Some degree of hemoptysis is present in about half of all cases of pulmonary tuberculosis. Pleuritic pain may result from the extension of the infection to the pleural surfaces.
Globally, 23% of the world's population were estimated to be infected with M. tuberculosis complex in 2014, equivalent to the best estimate of 1.7 billion people. In 2016, there were an estimated 10.4 million incident cases. 1 million of the estimated incident cases were among people living with HIV infection. Let's see this infographic to see the impact of tuberculosis worldwide.
What are the important features of Mycobacterium tuberculosis?
Mycobacterium tuberculosis is a species of pathogenic bacteria in the family Mycobacteriaceae, and the causative agent of tuberculosis. M. tuberculosis has an unusual, waxy coating on its cell surface, primarily due to the presence of mycolic acid. This coating makes the cells impervious to gram staining, and as a result, M. tuberculosis can appear either gram-negative or gram-positive. Acid-fast stains such as Ziehl-Neelsen, or fluorescent stains such as Oriman, are used to identify M. tuberculosis. M. tuberculosis is highly aerobic, and requires high levels of oxygen. Primarily a pathogen of the mammalian respiratory system, it infects the lungs.
Let's test your understanding of the topic. Which diagnostic test is intended for latent tuberculosis infection? Interferon gamma release assay. ELISA for TB antibodies. Polymerase chain reaction. Sputum smear microscopy.
What are the cultural characteristics of Mycobacterium tuberculosis?
M. tuberculosis can be grown in the laboratory. Compared to other commonly studied bacteria, M. tuberculosis has a remarkably slow growth rate, doubling roughly once per day. Commonly used media include liquids such as Middlebrook 7H9 or 7H12, egg-based solid media, such as Lowenstein-Jensen, and solid agar-based, such as Middlebrook 7H11 or 7H10. Visible colonies require several weeks to grow on agar plates. It is distinguished from other mycobacteria by its production of catalase and niacin.
What is the pathogenesis of pulmonary tuberculosis?
Infection by M. tuberculosis proceeds in steps, from initial infection of macrophages to a subsequent T1 response, that both contain the bacteria, and causes tissue damage. Early in infection, M. tuberculosis replicates essentially unchecked, within macrophages, while later in infection, the cell response stimulates macrophages to contain the proliferation of the bacteria. The steps in infection are as follows. 1. Entry into macrophages. 2. Replication in macrophages. 3. Multiple pathogen-associated molecular patterns of M. tuberculosis. 4. The T1 response. 5. T1-mediated macrophage activation and killing of bacteria. 6. Granulomatous inflammation and tissue damage. 7. Role of other immune cells. 8. Host susceptibility to disease. Finally, immunological state in active tuberculosis.
Let's test your understanding of the topic. What is the main virulence factor in TB pathogenesis? Bacteria's ability to survive inside the bronchi. Bacteria's ability to destroy the macrophage. Bacteria's ability to destroy the pulmonary tissue. Bacteria's ability to survive inside the macrophage. What is the characteristic finding in progressive primary tuberculosis? Presence like bacterial pneumonia. Cavitation occurs readily. Regional lymphadenopathy is less common. Miliary tuberculosis does not develop.